Welcome back to Critical Moments with the Neonatal Nurse Educator, Part 13. This week is all about the late preterm infant, and we have been discussing this week all about when does a baby get admitted directly to the NICU, at what age, and what gestation. There does seem to be a variety in practices, so I want to talk about those babies that do initially stay on mom baby and what that could look like to recognize these critical moments. First, you are the admit nurse and you get a call from the nurse practitioner about a 35 and 6/7 weeker. The baby was initially great at birth. The nurse practitioner was there because the baby was less than 36 weeks and no resuscitation was needed. The baby's doing skin to skin. The nurse practitioner is writing her note. At that time, she notices the baby is starting to have some soft grunting. So she places a pulse oximeter on the baby and he looks okay. However, the grunting is getting stronger, and so she decides to admit the baby to the NICU. Why is this a critical moment? It is because grunting is a baby's auto peeping. They are trying to keep their alveoli open for gas exchange. In late preterm infants, this can happen due to decreased surfactant production, retained fluid from delivery, and overall less tone in their body. So while this baby initially looked great, the nurse practitioner knew that this could be an impending sign that something was going wrong. Therefore, she admitted the baby to the NICU. Next steps would be to get the baby on CPAP before they tire out and giving them PEEP so they don't have to auto PEEP, placing an IV since they will not be able to orally eat, and making sure that they have good thermal regulation in a radiant warmer or an incubator. From there, we would support them as needed.